Do you suffer nerve pain for many years in your legs and feet, or even in your arms and hands and or legs and feet? If you do, and you've tried different therapies and they haven't worked for you, stay tuned. You can hear a whole different viewpoint in the rest of this video. Hi, my name is Dr. Lonnie Herman, and in this video I'm going to share with you how a man who suffered for 7 to 8 years with intense calf pain in his right leg, intense foot pain, severity about a level 10, on a scale of 0 to 10, 10 is the most severe, in the right foot. He even had pain in his left foot. I'm going to pause right now and let you hear him actually state the level of pain he was in and the amount of relief he experienced after his second visit with me. Let's hear that, and then I'll be right back. You've been dealing with peripheral neuropathy.
Yes.
And the neuropathy has been in your feet and your legs?
Yeah, mainly my right leg and my right foot.
Okay. Is there any neuropathy that's been in the left foot at all?
Somewhat.
Somewhat.
Not nearly as bad.
Not nearly as bad as the right. Is that neuropathy in the left foot, has it been only in the toes or has it been in the sole of the foot also?
Mostly the toes.
Okay. And what sensation in the toes have you felt?
Just burning and numbness.
Burning and numbness. Was there any tingling, pins and needles in those left toes?
Somewhat.
Somewhat, okay. On a scale of 0 to 10, if 10 is the most severe of all those symptoms, how was the left foot? 10 is the worst.
The left foot was probably a 4 or 3.
3 or 4?
Yeah.
Okay. Now the right foot, we'll talk about the calf in a minute, but the right foot, your right foot has been numb and or burning and or tingling or pins and needles.
Yes, absolutely, and probably a 7 or 8.
Okay. And the toes were more pins and needles than the foot?
Yes.
Yeah.
I would say yes.
These, in both feet, has this neuropathy been a constant problem for you?
Yes, it has.
How, day and night?
Day and night.
Day and night. How many years have you had this neuropathy experience in both feet?
Probably 7 or 8 years.
Has it been the constant same amount of neuropathy, or did it get worse over the years?
It steadily got worse.
Okay. And you also talk about the calf from the knee down, but the calf to the heel.
Yeah.
And that was what kind of feeling was it? Burning?
Burning, tingling. You'd reach down and touch your leg and it would just tingle. You couldn't feel the touch, it would just tingle. Mm-hmm. There was a tingling, there was no touch, no feel to it.
And on a scale of 0 to 10, if 10 is the worst with the calf?
It was probably a 7.
Okay. And we've used the word was.
Yeah, it was.
Yeah. Well, that means past tense, right?
Yeah,
okay.
absolutely.
For 70 years, how many different doctors have you been to? Give or take, maybe.
3 to 5.
3 to 5. And have you been to hospitals because of this?
Yeah, I've had MRIs done, CAT scans done, lots of different tests.
Mm-hmm. And what do they tell you?
They all tell me to go to physical therapy.
Have you done that?
I've done physical therapy with probably 4 or 5 physical therapists, and physical therapy didn't work.
And
it makes you stronger, but my legs don't get stronger at all. My legs do not get stronger.
Well, what got stronger then?
You what?
When you said it got you stronger, but the legs never did get stronger.
The leg, my upper body.
Oh, okay. And did they give you medications for the neuropathy?
They wanted to, but I seemed to have a bad reaction to it, so I tried it for a short period of time, and I didn't take it for a long period of time.
Give up on that.
Yeah.
And now, what are you telling me now, right after this visit here? And today is June 10th, 2019. It's our second visit together. And what are you telling me now as we're done with the second visit? What is the change that you've experienced right now? Not a percentage, we'll talk about percentage of relief, but what are you feeling in the feet?
The tingling is still there, but it's not what it was, even close.
Not even close?
Not even close.
How much of a difference of a percentage-wise? If we could say how much relief, let's say.
It was 7 or 8 before, now it's probably 2 or 3.
2 or 3. So on a percentage scale, could you give me a percentage of improvement right now?
Probably 70, 80%.
70, 80% of relief of the
burning and tingling.
in the foot,
in the
right
foot
foot,
and the calf.
and the calf. So 70 to 80% in the foot and the calf of the burning and the tingling.
Yeah.
Okay. Is there any other change in the left foot that you noticed?
The tingling is almost non-existent in the left foot at the moment.
At the moment. So you're talking, if you can give a percentage of relief of the tingling, a percentage-wise. When you say almost, are you talking
probably
like
80%.
80%
Yeah.
on the left foot? That's pretty remarkable.
I'm very happy right now.
Yeah.
I'm very happy. I went from being depressed to pretty happy.
Yeah.
Pretty happy gentleman I am.
Okay. And is the point that I'm making with you about what causes neuropathy, now that you can actually witness it and you experience it, is the point that I'm making with you about finding the causes of it? Does it make a little more sense than what you've experienced before with the other physicians you've been to?
Absolutely. You go to the cause, they want to treat the symptoms, and he gets to the cause, what's causing it.
Okay. So right now we're doing pretty good. We're happy.
Right now we're happy.
Right now we're happy.
Right
I'm only going to get happier.
Good.
I'm only going to get happier.
That's what it's all about, getting happier.
Isn't that just incredible how much pain and relief he finally experienced? I'll tell you, one thing in this man's history was he had chemotherapy several years ago for cancer in a part of his body. We don't have to go into great detail about that. He had chemo that was about 11 years ago. His pain started about 7 to 8 years ago in the right calf, the right foot, and the left foot. Non-stop 24 hours a day pain. Non-stop, only getting worse over the years, leaving him very depressed. So he had chemotherapy that was done about 10, 11 years ago. He survived. Great for that, great for the doctors. He's a survivor. I'm happy for that for him. But I also thought that maybe the chemo that was given to him created a delayed effect on his nervous system. It was possible because the chemo goes in, who says it all comes out, and does it have to cause the neuropathy right away with chemotherapy? I don't think so. In any event, I started care with him, or he started with me, back in March of 2019. When he came back after his first protocol, which we'll get into in a few minutes, he had no change in the symptoms in his calf, no change in the symptoms in both of his feet. It was identical and depressing. He was very upset, but he still had enough faith to come back for another visit with me because he had seen other positive testimonials from other patients on my YouTube channel, and just something, he told me something was different about what I was presenting him, that he had to give it another try. Now, I will tell you, even before I get into these unique exam findings, there's no way for us to know how many different, what I believe are infections and toxins that get into your central nervous system and other parts of your body that lead to these kinds of neuropathy pains. There's no way to know how many different infections and toxins are doing that to you. That's what's causing the pain. Doctors will tell you, you have nerve damage, you have small fiber neuropathy, you have peripheral neuropathy. They don't know why. They can run all their tests. They can do MRIs. They can do blood tests. They can do nerve conduction studies. I studied nerve conduction studies in postgraduate neurology school. I took the courses. I studied neurochemistry. I studied neuroimmunology. I studied functional neurology, several hundred hours. I've been very involved in the nervous system for many years. And going back, probably started learning about 12 years ago. And one thing that I learned when I took the neuroimmunology program is what this immunologist shared with us is that there are different infections and chemicals that these researchers around the world have found are in people's tissues and are causing the different nerve pain disorders. So I went on a journey to find, how can I find these different infections and toxins in the tissues? I ran stool tests, I ran blood tests, I ran hair analysis, all of which left me puzzled, because not always did a blood test show us that there was some infection or toxin that was in the blood that was related to the person's nervous system disorder. So there's a system that I discovered that was, I won't get too deep into this now, but a system I discovered that was developed through this Institute of Biophysics in Germany. And these scientists are brilliant on what they discovered, and a brilliant cardiologist, great mentor of mine, brought this over to the US and helped us really understand that there's a different way of examining the body. And when I can put together to what I've created called my functional neuro recovery therapy, that when we can put together a nervous system exam and understanding neurochemistry and understanding the vestibular system in the person, the balance apparatus in that nervous system, and understanding about this unique kind of bioresonance and biophysics research out there, we can get people better where other systems have failed. And this man is now claiming, after a second visit with me, claiming what you might say, but the reality is he said 70 to 80% better in his right calf and his right foot, and the same for the left foot after a second visit. In his first examination in March of 2019, I found in his kidney tissues and his ureters, the renal pelvis tissue, which is part of the kidney, the ureters, the left kidney, I found infection and chemicals in the right kidney. And we went after those with unique remedies that we created for him in our laboratory. And there were infections like malarial parasitic infection in his kidneys, and there was mold, and there was black mold, and staph infection, and botulinum bacteria, and there was parasitic infection in his ureters, and mold in his ureters, and also he had chemotherapy agents in his kidneys, and he had mercury in his kidneys, and he had chemo agents in his hypothalamus. Remedies were given to him to help him get rid of these chemicals and infections that he took at home, very simple to take. When he came back, he did not feel any better, he felt the same. In his second examination though, I found with a very unique bioresonance method of testing, along with, again, nervous system analysis and other forms that I put into this functional neuro recovery therapy program that I offer people, I found that in his glial cells are cells, there was infection and chemicals in there. The glial cells are cells which protect your neurons, repair your nerves, and reproduce the myelin coating on the nervous system. So what happens when those glial cells that repair the nerve and protect the nerve and reproduce the central nervous system material and peripheral nerve material, what happens when those cells are sick, when they're toxic, when they're infected? How are they going to be able to repair the nervous system? How are they going to be able to take care of it and protect it? They can't. I found in his glial cells that I believe they were being damaged by infection by botulinum bacteria, the parasite from malaria, propofol general anesthetic. He did have knee surgery in his past. That anesthetic, I believe, was still in his glial cells, not letting them repair and reproduce nerve tissue. Lidocaine dental anesthetic, local anesthetic from the mouth, was in his glial cells, crippling them. He had chemotherapy agents, chemochemicals, damaging, stressing, absorbed into his glial cells, causing them impairment in their ability to repair and reproduce and protect his nervous system. I believe his myelin was toxic with the chemo agents. His cortex of the brain has a map of the whole body. The cortex of the brain feels your tissues feels your feet. So a doctor can tell you that you have small fiber neuropathy, they can tell you have peripheral neuropathy, they can tell you that the nerve is dying. What happens when a part of the brain goes bad from a chemical or infection? Doesn't have to be a stroke, doesn't have to be an aneurysm. What happens when the chemical gets up into a part of the brain and stays there like a dye in a shirt? You put a dye in a shirt, it stays there. What happens when chemo gets up into that part of the brain? And the chemo is causing a toxic effect in the cortex of the brain, and that part of the brain that feels the left foot, or feels the right foot, or feels the calf, or feels your hand, or feels your arm, or feels your chest, or feels your back, or helps you perceive the feeling in your face. What happens when the chemicals in the part of the brain called the cortex, and now that brain can't do its job and be able to feel your hand or your leg normally, or your foot normally? Think about this. Understand, when scientists for more than 100 years have been able to cut off a skull cap and put a needle in a part of the cortex of the brain, nobody feels the needle go into the brain, but they could say, I feel pain in my hand. I feel pain in my foot. There's something in neurology called the homunculus. Homunculus is also called the little man. And we know that there's a map of the brain. You can look up homunculus. I'll put the word up on the screen, so if you want to look it up later and try to understand, do your own research and understand a little more. We have a map of the body in the cortex of the brain, and we can actually get poisons and infections that get up into the cortex of the brain. They can cross what you think the blood-brain barrier that's intact. Who says it's intact in you? Who says it was ever intact in you? Okay, there's different pollutants that were discovered in a study in 2005 by the American Red Cross, where the scientists went across the United States and took brand newborn infants still attached to the mother's umbilical cord. They were naturally born, no C-section, no vaccines given yet. They seemed to be healthy newborn infants. They found in their biopsies of their tissues, and there was not one particular city in the US, they went any city, any state, any hospital in the US. They found 287 chemical pollutants in their body. 287 toxins in their body at birth. They didn't even get cut from the mother's cord yet. They found the same chemicals in the mother's cord. What makes you think that your blood-brain barrier is perfectly intact? Chemo can get up into the brain. It did, I believe, for him. Lyme infection in his cortex of his brain. He had, he also had, where was the other? There was chemo that was in the white matter of his nervous system. And he had some chemo in the meninges, which are around and that surround and protect your brain and spinal cord. And these meninges have nerves and arteries that go into the brain and spinal cord. They're deeply invested into the brain and spinal cord. So when there's something in the meninges, you can have a malfunction in your central nervous system, causing a problem in a limb. He also, I believe, he had propofol general anesthetic in the parietal lobe, which is a part of the brain, and including part of the cortex, as I mentioned before, that actually is where we have sensory nerve roots for the nerve endings. So the right parietal lobe has the nerve roots for the nerve endings in your left foot. The left parietal lobe has sensory nerve roots that have nerve endings in the right foot, in the right hand. So when propofol general anesthetic gets into that parietal lobe, what's going to happen to the way that parietal lobe is able to feel and function and be able to perceive what's going on or sense what's going on in your foot? It just can't do that normally. You can feel neuropathy in a limb because a chemical and or an infection got into your brain. And it doesn't have to be a swollen brain. You don't have to have a fever. You don't have to have a stroke. God forbid that ever happens to us. You don't have to have that. You can have chemicals and infections that get into your brain and cause your body to malfunction. After that visit in June of 2019, I'm filming this in August 24th of 2019. After that visit, that man was so excited because he finally, for the first time in 7 to 8 years, first time, he had relief, 70 to 80% relief from his neuropathy. 70 to 80% relief from his neuropathy, and most of it was caused by chemo. There were some others I listed here, but chemo that was in his central nervous system from treatment that was done 11 years ago. Again, my hat's off to the doctors who saved his life from the cancer, but the chemo did have a delayed effect on his nervous system. I have a very unique system and unique set of tools, a unique set of knowledge that I can, and skills that I can actually examine your nervous system in a different way and find if there's any chemical pollution and or infections that have gotten into your central nervous system, different parts of the brain, and we can provide you safe and effective remedies that will get these infections and chemicals out of your nervous system, and you too can experience repair like this man. You too can experience reduction of your pain. If you don't believe it's possible, why are you searching online? If you don't believe it's possible, that you can get better, and the doctors told you have nerve damage, what are you looking for? What are you looking for if you believe their words that it's nerve damage? Okay? You've got to be able to step out of the box and start to think a little different and appreciate different bits of information that's out there so that you can finally find someone who can help you get the relief from your condition. And your results, for me and my clinic, your results are all that matter to me. Getting you well, helping you get well is all that matters. That's it. That's what I'm driven to do, is to help you get well. My clinic is located right now in South Florida. You can contact my clinic. I'll put the number up here soon. You can contact my clinic to make a special kind of investigation consultation appointment with me. That appointment would be before your unique hands-on in-person examination. In person, a very unique, different kind of test that you've never had done before. Okay? Listen, insurance companies don't recognize the kind of work that I'm offering. So this is out of pocket. This is your responsibility to invest in yourself to get yourself better. And I'm here to help you do it for you. I'm here to help you do it. You can contact my clinic at 954-370-3100. That's 954-370-3100. Or you can go to the clinic email address. I'll put this up on the screen here. You can go to this email address and you can speak to my assistant through the email system, again, or by phone, and she'll help you arrange an appointment. On average, my exam appointments are about 2 months into the future. We've got about a 2-month waiting list, okay? So be prepared to wait a little while, although we can do a phone consultation or a Skype consultation or an in-person consultation on average before usually within the next month or so, we can provide you that appointment, okay? My assistant will go over the fees with you. And again, I'm here to get you well. I'm here to help you achieve relief from your condition. And I really believe it's possible. And this man, after 7 to 8 years of suffering, 70 to 80% better after a second visit with me. And nobody ever did that for him. Not one of his doctors, not one of the different tests that he had done. And watch the rest of that video. You'll hear him talking about all the different exams and all the different studies that were done with him. And there were many, okay? You can contact my clinic at 954-370-3100. Also, you can like me on Facebook. I put up information there on a pretty regular basis. I put up information on my Instagram. You can follow me on Instagram. And subscribe to my YouTube channel. And always hit the bell for notifications so that you can get an email whenever I put up a new video on my YouTube channel. And look through the other videos that I have. Look through the other neuropathy videos that are on my YouTube channel. Some pretty impressive recoveries here where people literally thought that they could never get better, but they were still hopeful that they could get better. You can get better. I'm here to help you. I look forward to helping you soon. Thank you for watching this video. I hope it did help you. And if there's anybody else you know who could benefit, please share this with them.